Ultrasound therapy. Sounds are mechanical vibrations of matter in an expanding medium. Humans can hear sound with a frequency of 20 to 20,000 Hz. Sound with frequencies below 20 Hz is called infrasound. Above 20,000 Hz is called ultrasound. Generation of ultrasound. Ultrasound is generated by applying a high-frequency alternating electrical current to the crystal in the transducer of an ultrasound unit. The crystal is made of a material with piezoelectric properties, causing it to respond to the alternating current by expanding and contracting at the same frequency, at which the current changes polarity. When the crystal expands, it compresses the material in front of it, and when it contracts, it rarefies the material in front of it. This alternating compression rarefaction is the ultrasound wave. As a result, the ultrasound beam acts as a pressure wave on the body's tissues. Because the sound reflection between the transducer and the air is 100%, in the treatment it is necessary to have a medium between the transducer and the skin, such as a layer of gel, or ultrasound through water. Therapeutic effects of ultrasound. Ultrasound has a variety of biophysical effects. It can increase the temperature of deep and superficial tissues, and has a range of non-thermal effects. The thermal effects of ultrasound, including acceleration of metabolic rate, reduction or control of pain and muscle spasm, alteration of nerve conduction velocity, increased circulation, and increased soft tissue extensibility. Ultrasound heats small and deep tissues more than most superficial heating agents. The thermal effect is proportional to the absorption of sound waves by the tissue. Absorption depends on the nature of the tissue, the degree of perfusion, and the frequency and intensity of the ultrasound waves. Ultrasound heats tissues with high ultrasound absorption coefficients more than those with low absorption coefficients. Tissues with high absorption coefficients are generally those with high collagen content, and tissues with low absorption coefficients generally have high water content. Thus, ultrasound is particularly well suited to heating tendons, ligaments, joint capsules. The following table illustrates the attenuation index of 1 MHz ultrasound through different tissues. Generally, therapeutic ultrasound has a frequency between 0.7 and 3.3 MHz to maximize energy absorption, at a depth of 2 to 5 cm of soft tissue. With 3 MHz ultrasound, as compared with 1 MHz ultrasound, and in tissues with higher collagen content, the depth of penetration is lower, although the maximum temperature achieved is higher. Ultrasound of 1 MHz frequency is considered best for heating tissues up to 5 cm deep, and 3 MHz frequency is considered best for heating tissues only 1 to 2 cm deep. In contrast, the heat production of 3 MHz ultrasound is 3 to 4 times greater than that of 1 MHz ultrasound with the same intensity. On average, soft tissue temperature has been shown to increase by approximately 0.2 degrees Celsius per minute in vivo, with ultrasound delivered at 1 W per square centimeter at 1 MHz. Ultrasound has a variety of effects on biological processes that are thought to be unrelated to any increase in tissue temperature. These effects are the result of the mechanical events produced by ultrasound, including cavitation, microstreaming, and acoustic streaming. Ultrasound with low average intensity has been shown to increase intracellular calcium levels and to increase skin and cell membrane permeability. It has also been shown to promote the normal function of a variety of cell types, because the cellular level and vascular processes demonstrated to occur in response to low intensity. Ultrasound are essential components of tissue healing. Indication, contraindications, and precautions. Ultrasound is widely indicated in trauma and soft tissue pathology. Continuous ultrasound is used when we want a thermal effect, so it can be indicated in muscle spasm, soft tissue contracture and soft tissue pain. Examples such as tendinitis, shoulder pain, plantar fasciitis, carpal tunnel syndrome. Pulsed or intermittent ultrasound is used when we want to facilitate tissue healing, so it can be indicated in acute soft tissue injury or inflammation, acute peripheral neuritis or trauma, skin ulceration. The picture above illustrates ultrasound around the wound to stimulate wound healing. Some of the contraindications of therapeutic ultrasound are pacemaker placement area near the fetus during pregnancy, such as in the abdomen, waist, pelvis, eye, genital, brain, marrow, heart region. The area is bleeding or infected. Malignant tumors, thrombophlebitis because of the risk of thrombosis. Artificial joints have cement because they cause joint loosening. Some precautions when using ultrasound are acute inflammatory zone, growth cartilage head, fracture, prosthetic breast. In general, therapeutic ultrasound is quite safe, with few side effects. The most common adverse effect is a burn, which may occur when high-intensity, continuous ultrasound is applied, particularly if a stationary application technique is used. The risk of burns is further increased in areas with impaired circulation or sensation and with superficial bone. To minimize the risk of burning a patient, always move the ultrasound head, and do not apply thermal level ultrasound to areas with impaired circulation or sensation. Reduce the ultrasound intensity in areas with superficial bone, or if the patient complains of any increase in discomfort with the application of ultrasound. Ultrasound treatment parameters. Frequency. The frequency is selected according to the depth of the treated tissue. For tissue up to 5 cm deep, 1 MHz is used, and 3 MHz is used for tissue 1 to 2 cm deep. Duty cycle. The duty cycles are selected according to the treatment goals. When the goal is to increase tissue temperature, a 100% continuous pulse cycle should be used. When ultrasound is applied for non-thermal purposes, a pulse period of 20% or less is recommended. Intensity. Intensity is selected according to the treatment goal. When the goal is to increase tissue temperature, the patient should feel some warmth within 2 to 3 minutes of initiating ultrasound application and should not feel increased discomfort at any time during the treatment. When 1 MHz frequency ultrasound is used, an intensity of 1.5 to 2.0 W per square centimeter will generally produce this effect. When 3 MHz frequency is used, an intensity of about 0.5 W per square centimeter is generally sufficient. For non-thermal effect, intensity should be lower, about 0.5 to 1 W per square centimeter with pulsed ultrasound, and 0.3 to 0.5 W per square centimeter with continuous ultrasound. Duration. Treatment duration is selected according to the treatment goal, the size of the area to be treated, and the era of the sound head. For most thermal or non-thermal applications, ultrasound should be applied for 5 to 10 minutes for each treatment area, that is twice the era of the transducer. In general, treatment duration should be increased when lower intensities or lower frequencies of ultrasound are used. When areas larger than twice the era of the transducer are treated, or when higher tissue temperatures are desired. Number and frequency of treatments. The recommended number of treatments depends on the goals of treatment and the patient's response. In most cases, ultrasound can be used from 10 to 15 times of treatment. The frequency of treatments depends on the level of ultrasound used and the stage of healing. Thermal ultrasound is usually applied only in subacute or chronic stages of healing. The recommended frequency of treatment is 3 times a week. Non-thermal ultrasound can be treated in an earlier stage and applied daily. Moving the sound head. The sound head is moved at approximately 4 cm per second, quickly enough to maintain motion and slowly enough to maintain contact with the skin. If the sound head is kept stationary or is moved too slowly, the area of tissue under the center of the transducer, where the intensity is greatest, will receive much more ultrasound than the areas under the edges of the transducer. With continuous ultrasound, this can result in overheating and burning of the tissues at the center of the field. And with pulsed ultrasound, this can reduce the efficacy of the intervention. If the sound head is moved too quickly, the therapist may not be able to maintain good contact of the sound head with the skin, and thus the ultrasound will not be able to enter the tissue. The sound head is moved in a circular or parallel line and the surface of the sound head is kept in constant parallel contact with the skin to ensure that ultrasound is transmitted to the tissues. Here is a decision-making chart for ultrasound treatment parameters that may be helpful for remembering. This video does not demonstrate the technique of phonophoresis and ultrasound stimulation for bone healing. Thank you for watching.